Michel, thanks very much for speaking to France 24 today. You will have heard in that report reference made to the rise in the number of cases, particularly here in France. What do you put that down to? Is it a laxist attitude, or is it indeed the way the virus is behaving?
I don't think that the behavior of the virus is dramatically changing. What we know is that when the virus traveled from China to Europe, indeed its infectiosity increased to some extent. But the reason for the current problems that we are facing is different. I think that during the confinement, the population was indeed willing to help in the fight against the virus. And at this time, the measures were better accepted than they are now, because the disease is no more really visible. So we don't see anymore these tragedies in hospitals, in nursing homes. So people want to enjoy life again. They don't want to be restricted in their different activities. And at the same time, they don't realize that they expose themselves, their beloved one, to major risks. And this is important that even the young people, including those currently on holidays, realize this, because then when they will be back, they will be again within their familial circles.
Let's talk about that. Professor, let's talk about that, because several countries, namely France this week, also the UK today, in fact, has, made masks compulsory in shops. I mean, is that too little, too late, or do you think it's still a measure that is of paramount importance at this stage?
No, I think it's important, and actually it should go together with the message that we are all again in danger. And that's again also true for young people. We still don't know what will be the long-term consequences, even in currently asymptomatic infections. There is a concern that diabetes might be triggered by COVID-19. So I think that we need indeed to reinforce the measures just to make our message credible. But at the same time, we have to communicate much more and much better, so that in a way citizens again become partners in the fight.
How do we communicate better? I mean, there will be some who say, for days on end, there have been communication about the COVID-19 virus and how to deal with it. We're seeing adverts, all the time. How do you think communication could be better when it comes to COVID-19?
I think it should come better by clearly communicating and transparently on issues which indeed were minimized, such as the high percentage of infected people who will not present any symptoms. It's more than half of the infected people who remain asymptomatic. And those are the people who might play a very important role in the transmission chain. This is still not clear in the population, and it should come clearer. And the other important message is indeed those situations in which you meet your beloved one, you meet your friends, sometimes in rather small meetings, and this might be extremely dangerous situation, especially when you come back from holidays where clearly the social distancing measure will be more relaxed.
Just a final question, Professor, briefly, when it comes to immunity, because this is very much a grey area as well. Do we know with people who've contracted COVID-19 are immune, and whether they can get the virus again?
I agree that there is confusion on this, and there is also an area where we should communicate better. The latest information is that most people who suffered from a significant infection with symptoms are still protected, either with antibodies or with other types of immune defenses involving the so-called T lymphocytes. So I think that this is important, that we realize that most likely for the time being, people who suffer from COVID-19 will not experience a new infection themselves.